Hello, everyone, and welcome to Dr. Paul Health and Wellness System weekly podcast. I'm so happy you're here. This podcast is to answering the most frequently asked questions about maternal health, from preparing for pregnancy to pregnancy itself, childbirth, and life after delivery. Every week, I'll be sharing practical, evidence-based medical advice in a way that's simple, easy to understand, and applicable to everyday life. Now, for today's episode, we're talking about the first signs of pregnancy. Over the past few weeks, I've received so many messages and questions in my DMs from women asking things like, how do I know I'm pregnant? Is it normal to bleed? Why am I so tired? Are cramps normal in early pregnancy? If you've been asking any of these questions, then you're in the right place because today we'll answer them one after another. Before we get started, let me quickly introduce myself. My name is Dr. Paul. I'm an obstetrician and women's health physician, and my passion is helping women make informed decisions through reliable, evidence-based medical education. Here on this channel is to provide you with trusted information that empowers you to have a healthier pregnancy and a healthier life. And if this is your first time joining us, I'd like to personally welcome you. If you're watching on Facebook or Instagram, don't forget to follow this page and share this episode with someone who may find it helpful. All right, let's get comfortable and let's dive into today's questions. One of the first signs many women notice is a missed period, but that's not always the very first symptom. Some women start feeling unusually tired, their breasts become tender, they may feel nauseous, need to urinate more often, or notice a heightened sense of smell. Why does this happen? As soon as pregnancy begins, your body starts producing hormones, especially HCG and progesterone. These hormones prepare your body to support your growing baby, and that's what causes many of these early changes. Remember, every woman is different. You may experience all of these symptoms, just a few, or even none at all. If you think you might be pregnant, take a home pregnancy test after you've missed your period, and book an appointment with your healthcare provider. Yes, you can. Light spotting during early pregnancy is actually more common than many people realize. Sometimes it's implantation bleeding, which can happen when the fertilized egg attaches to the lining of the uterus. It's usually light pink or brown and lasts only a day or two. However, if the bleeding becomes heavy like a period, is bright red, or comes with severe pain, don't ignore it. Seek medical care immediately because it could be a sign that something needs urgent attention. When in doubt, it's always safer to get checked. If you're newly pregnant and suddenly feel exhausted, that's completely normal. Our body is working around the clock to grow a baby, build the placenta, and support all the changes happening inside you. At the same time, progesterone levels rise, and this hormone naturally makes you feel sleepy. My advice is simple. Listen to your body. Get enough sleep, stay hydrated, eat balanced meals, and don't feel guilty about taking a nap when you need one. Extreme tiredness that comes with dizziness, shortness of breath, or fainting should be discussed with your healthcare provider. Yes, implantation bleeding can be completely normal. It usually happens about 6 to 12 days after conception, when the fertilized egg settles into the lining of the uterus. The bleeding is usually very light, just a few spots, and often pink or brown rather than bright red. Not every pregnant woman experiences implantation bleeding, so don't worry if you never see it. Both situations are perfectly normal. Absolutely. Some women notice changes even before they miss their period. You might feel unusually tired, your breasts may become sore, you may feel bloated, or notice mild nausea. Again, hormones are responsible for these early changes. But remember, these symptoms can also happen before a normal menstrual period, so symptoms alone cannot confirm pregnancy. The best way to know is with a pregnancy test after your missed period. Early pregnancy can be exciting, confusing, and sometimes even a little scary. The important thing to remember is that every pregnancy is different, and not every woman experiences the same symptoms. If you think you might be pregnant, confirm it with a pregnancy test and start your antenatal care as early as possible. Early care helps protect both you and your baby. Thank you for joining me today. If you have a pregnancy question you'd like me to answer in our next episode, leave it in the comments. I'd love to hear from you. Until next time, take care of yourself and your little one.